Meningitis. Frequently, this is the cause of the your loss of life. Once upon a time, very common. What happens? The inflammation of the meninges, the layers of the brain matter. So, how do this disease present? They have no fever, toxicity, your stiff neck, carnic sign, because of the your inflammation of the meninges around the base of the brain and also in the upper part, and they are quite toxic, and they should need immediate intervention. How to diagnose neck stiffness? If you see the neck rigidity, try to hold the neck back and to your and put it to your cheek with the chest. If you someone fails, or your failure to your flex your hip joint and your and the knee joint, you know. And basically, if you cannot do these maneuvers, refer to an appropriate person, to a pediatric neurologist, at least to a pediatrician, and in adult cases, adult neurologist and an adult internist. So they and these cases should be dealt faster and prompter, and the investigation in those cases is one papilledema, checked by ophthalmoscope, and if you do not see it, go for the lumbar puncture. And in case where you are not certain with papilledema with your ophthalmoscope, you can go for the CT scan of the brain. It will say more some informations like brain edema and pus collection. So diagnose it faster. And lumbar puncture says there is plenty of polymorphic leukocytes, gram stain positive and culture positive. It looks turbid. The CSF looks turbid. You do go for the empirical therapy until report comes for the culture, and the empirical therapy may be subtraction. In worst cases, meropenem or local sensitivity. Dose is a little bit higher in our antibiotic in meningitis. We call it meningitic dose. Starting earlier, optimal has different outcome, better outcome in appropriate place. If this child should be admitted in the hospital, they can have convulsion. So treat for the convulsion by anticonvulsant. Then they may not be able to eat and drink. So ensure this nutrition by gavage feeding, NG2 feeding, and parental means. They may have cerebral edema. They need to be given dexamethasone, acetazolamide, and other supportive cares, fever, and for associated dyslipidemia, they need to be addressed. Treatment is a little optimum 10 to 14 days, maybe 21 days. In a good amount of time, the late cases, there may be hydrocephalus, the past drainage, they need neurologic surgical referral, and appropriate handling, maybe shunt in the worst cases, and maybe drainage. And tuberculosis is an important differential over here, so it should be investigated by CSF AFB, CSF culture for the mycobacterium tuberculosis, and this tuberculosis serology, like your your gene expert, and current other modalities of so whatever the, and then associated lung tuberculosis exclusion by chest X-ray and MT. So this child should be taken care of immediately and optimally for better outcome and survival.